the COVID-19 pandemic, when many sectors in society, including healthcare facilities, became inaccessible, many individuals faced challenges in obtaining high-quality services. The concept of virtual hospitals spurred during the pandemic, when healthcare systems globally had to reform the way healthcare was provided. Virtual hospital essentially takes the hospital to the patients and provides them non-emergent care such as remote monitoring, medical consultations, diagnostic screenings, management of chronic conditions, counseling, rehabilitation services, patient education, and follow-ups. This concept of virtual hospital is not new. The term virtual hospital has emerged from the roots of telemedicine, which is the ability of healthcare providers to deliver care remotely through the means of telecommunication technologies. Telemedicine has been a growing field of medical services that allows the medical team to connect with patients without having them physically present in the hospital or a clinic. This type of service involves technologies integrated with artificial intelligence algorithms that serve as tools that support healthcare providers' ability to monitor, diagnose, and create treatment plans specifically catered for the individuals seeking care. So, what are some tools that are involved in virtual hospital care? Virtual hospital care provides patients with necessary tools that allows them to self-manage their care. For example, patients can use wearable devices, pulse oximeters, blood pressure cuffs, or glucose monitors that allow them to consistently assess themselves. These devices directly transmit the data to the medical team, allowing them to evaluate the results and make adjustments to the treatment plan. Patients also have the chance to connect with the medical team through video calls to consult them on any changes to their health conditions and ask any questions they may have. Through virtual hospitals, patients will have the opportunity to access their medical health records, schedule appointments, manage their medications, and even ask questions through virtual assistants that will guide them with their care. The AI algorithms integrated in many of the tools used as part of virtual hospitals make it more easy and accessible for patients to manage their care at home. Having these essential monitoring tools at home is not only a convenient way of health management, but it also serves as a sustainable way of healthcare delivery in non-emergent cases. These AI tools can be empowering for individuals and their families to actively engage within their care, while enjoying the comforts of their home. In order to understand virtual hospital better, let's look at a case scenario. Janet is a 70-year-old woman who has type 2 diabetes. A few months ago, she developed a life-threatening complication of diabetes called diabetic ketoacidosis, for which she had to be admitted to the hospital. Due to this complication, along with other chronic health conditions, Janet had a prolonged stay in the hospital, which prevented her from spending time with her family as well as doing things she loves. After a few weeks, the medical team determined that Janet was ready to be discharged. Although the idea of going home seemed exciting for Janet, she was skeptical about managing her diabetes when she went home. She was nervous that her blood glucose levels may fluctuate and she may end up with a complication again. So, how can Janet enjoy the comforts of her home while also ensuring that her health is being taken care of? Like Janet, many patients face challenges when being admitted to the hospital. They require to wait long hours, adapt to the unfamiliar hospital environment, and compromise on a lot of routines that they usually follow at home. Furthermore, some level of their independence is also taken away from them at the hospital setting. This can severely impact an individual's autonomy in regards to doing things by themselves, as well as taking a toll on their mental health. Virtual hospital is a non-traditional health service which allows patients to be in contact with their healthcare team without having to be physically present in the hospital. This type of service takes place at the patient's home with the use of technologies that monitor remotely, provide accessible platforms for patients, and provides reliable educational information for patients to follow in order to manage their care. Having the choice to opt for virtual hospital care would mean Janet would have the chance to go home but receive the same level of care she received at the hospital. She would be frequently monitored, have the chance to directly contact the medical team, as well as be able to coordinate with the medical team about any appointments she would need in the community. There are many benefits to expanding on virtual hospitals globally. This type of health service is convenient for many individuals, accessible during times such as pandemics or when individuals live far from hospitals or clinics, allows individuals to directly contact and follow up with the medical team about their health condition, enables individuals to practice their usual routines such as work, study, or spend time with family, improves the efficiency of care provided, and provides care that is patient-centered and catered towards their needs. Along with these benefits, there are also some challenges that continue to exist with virtual hospital. Individuals who do not have reliable internet access or mobile devices, or who live in underserved areas, may struggle to participate in this type of care. This type of service requires individuals to buy certain monitoring devices, which may not be affordable. Some individuals may not be familiar with using technologies, and there's always ongoing concerns regarding data security and privacy. Virtual hospitals have the potential to transform the way care is delivered. As artificial intelligence continues to develop, we can expect to witness new technological innovations being introduced to the healthcare system, which would greatly improve the way care is delivered to patients. Expanding on this type of healthcare can transcend many barriers that we face today in terms of healthcare services, such as long waiting hours, prolonged hospitalization, risk of hospital-acquired infections, compromise on lifestyles, and much more. So, what does this mean for the medical field? Healthcare providers should evaluate the impact that virtual hospitals can have for patients. As the medical field continues to grow in terms of advancing AI technologies to support clinical decisions, the medical team needs to be able to adapt to rapid changes that occur with technological changes and reflect on how their practice may alter from the traditional ways of patient care. Through ongoing research and innovation that address current challenges and reform healthcare policies and standards, virtual hospitals can revitalize care quality and shape how healthcare is provided in today's digital era.